My name's Heather Thompson, and this is my video assessment for NURS 3293 Health Assessment. This is my patient, Mr. Thompson. Mr. Thompson, I'm going to just do an assessment on you. Is that okay?
Yes.
Okay. So, before we started the video, I did Mr. Thompson's vital signs. They were 128/76. His respirations were 18. His pulse was 82, and his temperature was 97.9. He is 5'8" and weighs 208 pounds. So, the first thing I'm going to do is check Mr. Thompson's hair. I'm looking for any lesions or dandruff, and he doesn't seem to have any. The hair is growing evenly, there's no hair loss, and the hair looks clean and shiny. Okay. Next, I'm going to check Mr. Thompson's skin. Mr. Thompson's skin looks pink with a tannish color to it. It is warm and dry to touch. He doesn't have any edema, varicose veins, growths, or nevi. His skin turgor is elastic. His capillary refill is brisk, less than 2 to 3 seconds. His nail beds are pink with no cyanosis or pallor. His nails are rounded and clean. He has no pallor or cyanosis or erythema to his body. He does have a scar on his left foot. What happened that caused the scar, Mr. Thompson?
I cut it right in a dirt bike.
Okay, about how long ago was that?
Almost a year.
Okay, so the scar does have some purple discoloration to it, but there are no open areas, and it looks intact. Okay, the next thing I'm going to do is check Mr. Thompson's head. It is round. It looks a normal size and shape for a 33-year-old male. His face is symmetrical. His ears, eyes, nose, and mouth are symmetrical. I'm going to just check his ears. I'm just checking for any nodules. He doesn't seem to have any nodules. It feels normal. I'm going to look in the ears, checking for any drainage or lesions. Do you have any problems with your ears, Mr. Thompson?
No.
Okay. There's no drainage or lesions to that ear. And this one's normal also. Okay. While I'm on the ears, I'm going to go ahead and do a whisper test. I'm going to whisper something to you, and I'm going to have you repeat it, okay?
Okay. 1, 2, 3. A, B, C.
Okay. So he doesn't seem to have any problems with his hearing. Do you have any history of hearing problems?
No.
Okay, good. Okay, so the next thing I'm going to do is check Mr. Thompson's eyes. His conjunctiva is pink. It's normal. His eyes are moist. His sclera is white. His eyelashes are intact. He doesn't have any drainage or discolorations to his eyes. Okay, I'm going to just check for pupil reaction. If you could look straight ahead for me. And again. Okay, and the next thing I'm going to do is have you look at my pen light and just follow it. Okay, and then this way. I don't remember if I got them all. Okay, so his pupils are equal and reactive to light and accommodation. And his confrontation is normal. I'm sorry, I haven't done confrontation. His 6 points of gaze are normal. If I could have you focus on that window there, and then I'm going to hold the pen light, and I'm going to just have you look from the window to the pen light. Okay, again. Do it. Okay, his confrontation is normal. His pupils reacted to change from the far to near vision. Okay. Let's see. Next, I'm going to have you come over. We're going to do your eye test. I could have you stand right here. Okay. And I'm going to test your vision. I'm going to test each eye individually. I'm going to have you cover one eye and read this line for me.
D, E, F, P, O, T, E,
cover the other eye and read the same line.
D-E-F-P-O-T-E-C.
And now we're going to test both eyes together. Read this line again.
D-E-F-P-O-T-E-C.
Okay, so Mr. Thompson's vision is normal. He has 20/20 vision. Next, we're going to test the near vision. I'm going to have you cover the eye as well again, and we're going to test each eye individually and then together. Okay, can you read this line right here for me?
E-L. I can't read that.
Okay, try this one then.
P-T-L-F-C-E-D-E-C.
Okay, and cover the other eye, and we'll try it again.
P-T-L-F-C-Z-D-E-O.
Okay, and then both eyes together.
P-T-L-F-C-Z-D-E-O.
Good. Okay, so his vision is normal. You did have a little bit of trouble with the left eye, but you can follow up with an optometrist if you feel like you should just get annual optometry visits anyway, just to check your vision. Okay. All right. I'm gonna just have you have a seat right over here. Let's see. Okay. So next we're gonna move on to Mr. Thompson's nose. It, like I said, is symmetrical. I don't see any drainage. I'm going to look inside your nose. And I don't see any lesions. Okay. Do you have any problems with your nose today?
Just sinuses.
Okay, sinus problems. Okay, so I'm going to have you cover one nostril with the one finger and breathe through the other nostril. Good. Any problems there? Okay. And cover the other nostril. Okay. Any problems there?
A little bit.
Sounded like a little bit of congestion. Okay. I'm going to just check your sinus cavities. I'm going to just press. Let me know if there's any discomfort here.
No.
Okay. Any here?
No.
Okay, good. The next thing is I'm going to check your sense of smell. If you could, close your eyes for me. Can you smell this for me?
It smells like alcohol.
Good. Okay, and that is alcohol, so that's normal. The next thing I'm going to do is look at Mr. Thompson's mouth. His lips are pink and dry, no peeling or bleeding or anything there. Can you smile for me? Okay, can you smile without showing your teeth? Good. Okay, so that's symmetrical. Open your mouth for me. His mucous membranes are pink. His teeth are intact. And stick your tongue out and say ah. Good. His uvualized midline and his soft palate raises when he says ah. Stick your tongue out again. Point it to the left and then to the right. Good. Okay, so that's completely normal. The next thing I'm going to check is the temporal artery. I'm going to feel and then listen. And I don't feel or hear any abnormalities. There's no bruit. The next thing I'm going to do is check your jaw. Can you open your mouth for me and close it? Okay, open it and close it. And can you move your jaw side to side? Okay. So his jaw opens and closes easily. There are no abnormalities. There's no clicking or anything that would indicate TMJ. Okay. I'm going to have you. I'm going to test your neck range of motion. If you could, turn your head to the left and to the right. Good. His range of motion is normal. I'm going to have you turn your head this way and press against my hand. And this way. His strength is a 5 in the neck. And I'm going to have you tilt your head toward your shoulder. Just don't move your shoulder. Try and touch your ear to your shoulder. Go as far as you can. Okay, that's good. Okay, good. Okay, so his range of motion in his neck seems to be normal. The next thing I'm going to do is I'm going to look at the carotid and jugular veins to look for any pulsations. And I don't see any. I'm looking at the thyroid, or at the, at the trachea. It is midline. Okay? And it feels normal. Checking the carotid pulses. want to check them at the same time. I'm going to next listen to the trachea and to the thyroid. Can you swallow for me? Yeah. Good. Okay, no issues there. I'm going to check the thyroid. I'm going to have you swallow. And the thyroid is not palpable when he swallows, so that is normal. If the thyroid was palpable, it would indicate enlargement. Next, I'm going to check the lymph nodes. I'm going to check the pre and post-auricular lymph nodes, the occipital lymph nodes, the retropharyngeal lymph nodes, the submandibular lymph nodes, the submental lymph nodes, the superficial and deep cervical chain, and the supraclavicular lymph nodes. And none of them are palpable. If they were palpable, it would indicate that they were enlarged, and I would just describe those, but they are not palpable, which is normal. There's no lymphadenopathy. I'm sorry, I have trouble with that word. Next, I'm going to go over the Glasgow Coma Scale. Mr. Thompson has the first criteria is eye-opening. His eyes are open. He was alert when I came into the room. That scores him a 4. The next criteria is verbal response. He is oriented. Can you tell me what year it is?
Yes, 2015.
Okay. So he is oriented, which gives him a 5. And then the last is motor response. He is able to respond to commands. He occluded his nose when I asked him to, which gives him a 6. That's a total of a 15 on the Glasgow Coma Scale out of 15, which is completely normal. Okay. The next thing I'm going to do with Mr. Thompson is I'm going to do a breast exam. Mr. Thompson, a breast exam is normal. Most people think that breast cancer only occurs in women. It does occur in men, and it is more prevalent in causing death in men because of it not being identified early. So it is necessary for you to do breast self-exams on yourself monthly, just to identify any changes in your breast tissue so that we can easily identify it early to get you treatment, okay? So to do a breast self-exam, you put your hand behind your head here. I'm going to do the exam myself to start with, and then I'll have you show me that you can do it as well, okay? So you start on the chest wall here, and you work your way down, and you just feel the breast tissue for any nodules, lumps, or abnormalities, anything that is not normal to you, okay? And after you do this, first few months you'll know what your breast tissue feels like, and you'll be able to more easily identify problems. You also want to check in the armpit area here, which is the axilla. There are lymph nodes there that if you did have breast cancer, that could be involved as well. Okay, so I'm going to have you put this hand behind your head, and I'm going to check the other breast, and then I'll have you demonstrate for me. Okay. And so I don't note any lumps or nodules or any abnormalities in his breast tissue. So that's all completely normal. All right, Mr. Thompson, if you could, just show me how to do a breast exam. Okay, you want to start over toward the middle there? Yep. And that way you can work your way toward the outer. Okay.
So you just go up and down, you don't go around?
You're doing right, yes. Just up and down. And this is for male breast tissue.
Underneath here?
Yeah. You're doing great. Yeah, and just feel like right in here is usually where the lymph nodes are, and just make sure you palpate really deep there, and just that way you can tell if there's any enlargement to those lymph nodes. Okay? All right. So you did great. So about once a month. I usually recommend, like, if your wife is doing her breast self-exams, if y'all do remind each other, that helps a lot, okay? So the next thing I'm going to do is look at Mr. Thompson's chest. His chest looks symmetrical. Is a normal shape. There's no barrel chest, and that's good. His respirations are regular and non-labored. The rate is 18 as we counted prior to the assessment. What I'm going to do is listen to your lungs. I'm going to have you breathe through your mouth for me while I listen to your lungs, and that way I can get a good listen, okay?
Okay.
I'm going to listen in the front, and then I'll listen in the back, okay? Okay. We'll listen in the back. Sit forward for me. Good. Okay. And through your mouth again. Right. Mr. Thompson's lung sounds are clear bilaterally throughout both lungs. He has no adventitious breath sounds, no wheezing or rhonchi or crackles. The next thing I'm going to do is assess Mr. Thompson's heart. I'm going to listen with the diaphragm of my stethoscope and then the bell, so that way I can identify any extra heart sounds or murmurs. I'm going to listen over the aortic valve, pulmonic valve, Herb's point, tricuspid valve, and the mitral valve. Next, I'm going to listen with the bell of my stethoscope, Mr. Thompson has normal S1 and S2 sounds, no S3 or S4 sounds, no murmurs, gallops, or rubs. The next thing I'm going to check is for his pulses. I've already checked him for edema, and I've also checked his capillary refill, which was brisk. So I'm going to check the dorsalis pedis pulses. And they are even bilaterally and +2. I'm going to check the posterior tibial pulses. And they are even bilaterally and +2. I'm going to check the popliteal pulses. And they are even bilaterally and +2. And the radial pulses are even bilaterally and +3. And the brachial pulses are even bilaterally and +2. And then the carotid pulses I had checked earlier, but I didn't note the characteristics. They are even bilaterally and +3. Okay. The next thing I'm going to do is check Mr. Thompson's cranial nerves. The first cranial nerve is the olfactory, and we tested that when we tested his sense of smell with the alcohol swab. The next is the optic, the second cranial nerve, and we actually tested that when we tested his visual acuity. The next cranial nerves are numbers 3, 4, and 6, which are the oculomotor, trochlear, and abducens. We tested that when we noted that his eyes were, or his pupils were equal, reactive to light and accommodation, and we tested his 6 points of gaze, and we also noted that there was no nystagmus with that. The fifth cranial nerve is the trigeminal, and that involves sensory on the face. So I'm going to have you close your eyes, and I'm going to just test his sensory on his face. I'm going to touch your cheek with a soft object, and I'm going to just I want you to tell me when you feel it, okay, and which cheek.
Right cheek. Right cheek. Left cheek. Left cheek.
Okay, so his trigeminal nerve is intact because the sensory is normal in his face. You can open your eyes for me. The next cranial nerve is cranial nerve number 7, which is the facial nerve. We've already looked at his smile and had him show his teeth, which is part of the testing for that, and those were normal and symmetrical. Let me get you to frown for me. That's normal and symmetrical. Raise your eyebrows. Normal and symmetrical. I'm going to get you to puff your cheeks out like this, and I'm going to press against them. Okay? And that's normal and strong. And I'm going to have you close your eyes, and I'm going to try and open them, and you try to keep them closed. Close your eyes for me. I'm going to just pull against them. Good. And that is normal, and they are both strong. And their strength is even bilaterally. The next thing I'm going to check for would be the vestibulocochlear cranial nerve, which is cranial nerve number 8, and that's testing his hearing with the whisper test, which we already did. The other thing is cranial nerves number 9 and 10, which is the glossopharyngeal and the vagus. That's testing for the uvula being midline and the raising of the soft palate. We already tested for that, and it was normal. And then that tested both of those cranial nerves. The next cranial nerve is number 11, which is the accessory cranial nerve. The way we test that is we test the trapezius muscle. So I'm going to have you shrug your shoulders for me, okay? And then let it down, and I'm going to have you shrug your shoulders against my hands and see if you can do it. Okay, so his strength is 5 on that, and that is normal, and the strength is even bilaterally. The other thing we test for that is the sternocleidomastoid, which is where you have him turn his head left and right and move his ear toward his shoulder, which we already did earlier. The other is testing, the next is cranial nerve number 12, which is the hypoglossal. I had him move his tongue to the left and the right. The part that we didn't do of that is I'm going to have you press your tongue against your cheek, and I'm going to press against it just to check strength of your tongue. Good. And the other way. Okay. And so his tongue is strong. He is able to resist against my hand. The next thing I'm going to do is just check his sensation to his upper and lower extremities. What I'm going to do is have you close your eyes, Mr. Thompson, and I'm going to touch you with a dull or sharp object. I need you to tell me whether it's sharp or dull and where the sensation is felt. Okay?
Okay.
So close your eyes for me. Okay.
Dull on my right calf. Sharp on my left calf. Sharp on my left knee. Dull on my right arm. Dull on my right leg or knee. Sharp on my left arm.
Okay. Alright, so his sensation is normal with that. He is able to tell sharp and dull sensations in his upper and lower extremities. The next thing I'm going to check for is stereognosis, which is his ability to tell what object is in his hand when he closes his hand on it. I'm going to have you close your eyes. I'm going to place an object in your hand, and I want you to tell me what it is, okay? Close your eyes. I'm going to place it in this hand. Okay.
Feels like a coin.
Okay, good. I'm going to take that one, and then I'm going to place an object in the other hand. Tell me what that is.
Feels like a screw.
Good. And that is a coin and a screw, so his stereognosis is intact, it's normal. The next test is for graphesthesia. I'm going to draw a number in your hand. I'm going to have you open your hands just on your lap, just like you just did. I'm going to draw a number in your hand, and I want you to tell me what the number is, okay?
Okay. 3.
Good.
2.
Good. So he was able to tell what numbers I was drawing in his hand, so his graphesthesia is intact. It is normal. The next thing I'm going to do is check for tone and strength in his upper and lower extremities. Okay, Mr. Thompson, you can open your eyes. I'm going to have you lift your arms against my hands. Okay, and now press down. Okay, I'm going to have you squeeze my hands. Don't break them. So his strength is 5 in his hands and upper extremities. Okay. I'm going to check your lower extremities. Can you stick them out for me? Good. Okay. Press up against my hands and pull down. Okay. Push down against my hands and then up. Perfect. And his strength is 5 in his feet and lower extremities as well. The next thing I'm going to do is check his reflexes. I don't have a reflex hammer, so I'm going to use my stethoscope. Okay, so I'm going to just check your reflexes. Okay, reflex is good there. This one. Reflex is good. And then I'm going to check his bicep reflex and his tricep. Good. Good. Okay, all of his reflexes are intact. He had a reaction to all of what would be the reflex hammer in all those areas. Okay, the next thing I'm going to do is do the finger to nose test on him. I'm going to hold up my finger. I'm going to have you touch my finger and then touch your nose with your finger, okay? And do this several times just to, it's to test for coordination, okay?
Do I need to close my eyes?
No, you can leave them open. Touch my finger. Touch my nose. Touch your nose. Don't touch my nose, I'm sorry. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Okay? We're going to do it with the other hand. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Good. So that's intact. His coordination of his upper extremities is good. The next thing I'm going to do is have you stand. Well, first, I'm sorry. We're going to do the rapid alternating movement. Put your hands on your lap here, and I'm going to just have you flip your hands back and forth like this just to see if you're able to do that. Okay, good. So he is able to do the rapid alternating movement. Now I'm going to have you stand. I'm sorry. The next thing I'm going to do is have you walk with heel to toe over to the sofa just to check your balance. Okay? So I'm going to have you just take steps forward, put your heel in front of your toes like this. Okay? All right, whenever you're ready. Okay. Okay, and your balance is good. Okay. The other thing I want to do is just check your spine while we're standing here. Okay. We'll have you bend over. We're just checking for any abnormalities of your spine. Okay. And I don't see any kyphosis or scoliosis. Okay, and next thing, Mr. Thompson, I'm going to have you lay on the sofa. I'm going to check your abdomen. Okay, so I'm going to listen to Mr. Thompson's abdomen before I palpate just to prevent disrupting any or starting any bowel sounds that wouldn't normally be present. Okay, can you move your hands for me? I'm sorry. All right. Mr. Thompson's bowel sounds are present in all 4 quadrants. Now I'm going to just check the arteries, the iliac artery and the renal arteries, and just listen for any abnormalities there. And there's no bruit present. Okay. Do you have any tenderness to your abdomen? Does any of this hurt?
No.
Okay. His abdomen is rounded and soft. Okay. I'm going to just press. Let me know if there's any rebound tenderness. Do you have any pain when I let go?
No.
Okay. There's no rebound tenderness present. I'm going to just check his liver. I'm going to put my hand up under here. I'm going to have you take a deep breath in. I'm going to just feel for your liver. And his liver is not felt, which is normal, which means there's no enlargement of the liver. We're going to do the same thing on this side, checking for your pancreas. Deep breath in. Okay. And I do not palpate the pancreas, which is normal, which means there's no enlargement there. Okay. And that concludes my assessment of Mr. Thompson. I can help you up here. Okay. And thank you for watching. I hope I got everything.